Hello, today's lesson is on physical therapy roles and services at the VA. As our structure has gone for the previous videos, um, I am going to give you a rundown as if again I was presenting to the residents. Feel free to alter it and use it as you so please, um, and make it your own. So here we go. Um, so Do you guys know what physical therapists here at the VA do? Do you know the the diagnosis that they work with? Do you know what they're capable of doing? Um, Basically, what do you know they're able to do, and who they're able to work with while at the VA? Great, that was a great discussion, guys. I'm glad you have had some insight. Um, And I'm not here to tell anyone that the answers they're saying is right or wrong, but rather to give information that will further your understanding of what physical therapy is. So, textbook version or textbook definition of physical therapy is a dynamic profession with an established theoretical and scientific base and widespread clinical applications in the restoration, maintenance, and promotion of optimal physical function. Um, this is just a general overview of what physical therapists do. As we go through this session, I'll give you more in-depth information about what they do and who they work with and what we've seen here at the VA. So in this handout that I'm giving to you guys now, physical therapy treatment approaches essentially stem from enabling optimal performance while enhancing health, well-being, and quality of life. How do they do that? They do that by sustaining, restoring, and improving movement, activity, and function. So they are going to sustain, restore, and improve movement, activity, and function. Um, I know the textbook definition was clear about maintain, but I want, as I've said before, I want you guys to be clear to understand that um, therapists here at the VA do not work on maintenance of skills. If someone has no ability to functionally progress, there is no need for therapy. Sustain is more so to make sure they remain at a functional level rather than decrease. Um, and so, moving forward, some of the typical diagnoses here that we've seen at the VA that physical therapists work with are joint replacements, amputations, stroke, TBIs, spinal cord injuries, neurological conditions, inability to care for oneself, lymphedema, and conditioning. Many of you do not know there is a physical therapist here at the VA that specializes specifically in lymphedema. As I've mentioned before, there is no maintenance of skills. However, if a patient requires movement, as we have said before, the importance of mobilizing while in the hospital. Consult restorative nursing if they are in CLC. If they are not, make sure to put in mobility orders for nursing to see and implement with the staff. As we've also pointed out, or as we continue to read on, we mentioned their suicidal ideations without a physical decrease or change in functional status are some inappropriate consults that we've seen. We've seen alcohol withdrawals and agitation that impair a patient's ability to safely follow or perform commands would be the reason as to why to see them. But that would not that would it would be inappropriate if it's not being impaired. It would be inappropriate if the patient is requesting without objective goals. Uh, Obviously, we do not want to see repeated COPD exacerbation admissions, especially if they have previously been seen, and where their conditions are anticipated to resolve after they've been addressed medically. We also, lastly, have seen a lot of nausea and vomiting. That may cause a functional decline, however, can be resolved by being medically addressed. So yes, that is the basis and the general gist of what is seen here in the handout. And then you just talk to the students about it and run it through with them, and add any of your own insights and things that you have seen to this as well.